Hey guys, my name is Emma, and today I will be discussing different methods a therapist could use that would promote good behavior and focus in a classroom setting with children that have disabilities that affect their focus and behavior in some way, such as ADHD and dyslexia. There are many different therapeutic methods that could be used to promote good focus and behavior in students with ADHD and dyslexia. However, different methods of behavioral therapy, such as parent training therapy and therapeutic intervention, as well as phonics, will be discussed in this video. Ormrod and his colleagues define attention deficit hyperactivity disorder, also known as ADHD, as a disorder that is marked by inattention, hyperactivity, impulsive behavior, or some combination of these characteristics. They stated that every student at some point in time is bound to be inattentive, hyperactive, or impulsive. However, individuals with attention deficit hyperactivity disorder have significant and chronic deficits in at least one of these areas, if not multiple. ADHD causes individuals to have significant trouble focusing their attention and maintaining that focus on assigned tasks and on instruction. They also have ample amounts of energy and fidget around at inappropriate times, often causing other students to lose their focus and become distracted as well. Ormrod et al. Stated that about 6.4 million students in the United States are diagnosed with ADHD, and boys are twice as likely to acquire attention deficit hyperactivity disorder than girls. Medication can be prescribed to alleviate symptoms of ADHD, however, they do not cure ADHD. This is why behavioral therapy is important for students that have attention deficit hyperactivity disorder. According to Miller, behavioral therapy can help students that suffer from ADHD learn how to manage and control the core symptoms that they face, such as their lack of focus and their disruptive behavior. Another reason behavioral therapy benefits students greater than medication is that medication stops being effective when the individual stops taking it. However, behavioral therapy creates healthy habits and skills that will continue to benefit them as they grow in life. There are many different forms of behavioral therapeutic methods that would help a student that suffers from ADHD, depending on the symptoms that they have. According to Miller, students that have behavior problems would benefit from parent training, which is when parents and children work together in therapy to eliminate problematic behavior and learn desirable behavior. Miller states that this not only helps their behavior, but it also strengthens the child's relationships with the adults in their lives. This benefits their relationships as it teaches parents how to interact with their child differently so that the desirable behavior is promoted through positive reinforcements and the troubling behavior is discouraged through uniform consequences. The desirable behavior learned through parent training transports into the classroom setting, and over time, the behavior of the child in the classroom becomes more positive with fewer disruptions. Instead of using parent training for students that have attention and focus problems, Miller suggests that they would more likely benefit from the therapeutic intervention implementation from their educators in the classroom and their therapists in therapy sessions. Some interventions that would help students focus and attention could be checklists, time limits, and reward charts. According to Miller, if educators implement these things into the classroom and therapists in their therapy sessions, the focus and attention of students that have ADHD will increase as they develop systems for organization and their academics. This form of behavioral therapy can also be applied to students that have dyslexia. According to Shaywitz, a student with ADHD is 6 times more likely to have dyslexia than the average student. However, dyslexia is the #1 most common learning disorder. Dyslexia is defined by Shaywitz as a reading disorder that causes an unexpected inability to master basic reading skills despite having the same level of intelligence, motivation, and schooling necessary for the mastery of those skills. Individuals with dyslexia have trouble focusing their attention on what they read. Shaywitz states that of all individuals that have learning disabilities, 80% of them identify with having dyslexia. Unlike ADHD, there are no medications that can help with dyslexia. According to Eden, when students with dyslexia undergo therapy, they oftentimes become more confident with this disorder, which allows them to be more comfortable with getting help that they need in school to accommodate their learning disability so that they can be successful in their academics. Since dyslexia is primarily a learning disorder regarding language, it is hard to specifically treat with therapy to help with focusing. However, much like ADHD, different behavioral therapeutic techniques can help with their behavior regarding their attention. Besides helping students to become more confident in their disability and using behavioral techniques in therapy to improve their focus, therapists can also teach phonics. Phonics is the connecting of letters with sounds and blending those sounds into words. This is primarily done by reading specialists, teachers, and speech language pathologists. However, according to Eden, therapists also integrate it into their therapy sessions when needed. By incorporating phonics into therapy sessions, the therapist helps the student understand and read words better, which creates more focus for those individuals while reading and doing assignments than previously before. It is important for therapists to address the focus and behavior of students in the classroom so that they can attain academic achievements and life goals while not distracting other students that are in the same environment. ADHD and dyslexia were the only two disorders discussed in this video. However, it is important to keep in mind that there are many other disorders that affect an individual's attention and behavior in the classroom. Different methods of behavioral therapy, such as parent training therapy and therapeutic intervention, as well as phonics, can aid a student's ability to stay focused and have desirable behavior in the classroom. The same method to treat attention and behavior may not work for every student, so it is important for the therapist to use their discretion when deciding which method would work best for that student.